Hi everybody, my name is Dr. Jean-Paul Bohemier from Vibe Health and Spine. Believe it or not, it's common for people to injure their upper neck. Just think of all the falls, the accidents, how many times you've hit your head in your life, or the repetitive strain of working on a computer, playing sports, sleeping on weird pillows, looking at your phones all day. One of the reasons it's so common is because it's the most mobile area of your neck. And mobile areas are less stable and therefore more susceptible to trauma and repetitive strain. Because of your upper neck's importance in mobility, neurological function, vascular function, we feel it's important to make sure this area is balanced appropriately, and most people have never had it done in their entire lives because there's so few people who do specific upper cervical care. Some of the signs that your upper neck may need some work are decreased neck mobility, pain in the neck, headaches, dizziness, brain fog, difficulty concentrating, shoulder and upper back pain. Because of the complexity of the area, you don't just want anybody working on your neck. That's why we focus our practice on upper cervical care. So what's upper cervical care? It's probably the most common question. Upper cervical chiropractic care is a type of chiropractic that focuses on rebalancing the relationship of your skull, the first bone in your neck, and the rest of your spine. The treatment is performed by taking a series of very specific x-rays in 3 different dimensions, analyzing those x-rays to help understand how you're uniquely designed, and by applying a subtle pressure to the upper neck with either your hand or an instrument to improve the misalignment. Then we take a series of post x-rays to ensure that your body responded the way that we anticipated. And as a result, one of the best parts is that this type of work is that it's very gentle. So often people who are very scared of having their neck treated, but really need it, often really love this type of care. The other benefits of the precision of the work is that we often treat people a lot less than other procedures. So we usually cost less in the long run, even though you have the added cost of x-rays up front. There are different types of upper cervical care, but the 2 that we perform in our office are NUCCA and Atlas orthogonal. They're both very similar, but the main difference is how they go about the treatment. One is performed by hand and the other is performed by using a percussion instrument. They're both done on very specific angles off your x-rays. So if you're curious about this type of care and you feel as though you need more information, feel free to contact us and give us a call. Thanks for your time. Hopefully you enjoyed this video and you learned more about upper cervical care. That's our mission, is to share it.